Welcome to the Ross University School of Medicine, Procedural Skills, Airway Management. Gloves should be placed before equipment is inspected. Set up area with the equipment. You will need stethoscope, tube, towel, tube holder, airway adjuncts, blade, and suction. Laryngoscope setup. Ensure blade fits handle and lighting is optimal. Endotracheal tube. Check cuff for leak and leave syringe attached. Place stylet in endotracheal tube and shape the tube into a gentle curve. Place a towel underneath the head of the patient to support the head in the sniffing position. Procedure. Placement and technique of bag, valve, mask, and adjunct airways. Measure OPA correctly from corner of the mouth to the angle of the mandible. Apply the OPA correctly, starting with the tip of the OPA pointing cephalad. Then rotate OPA 180 degrees to where the tip reaches the posterior pharynx. Ensure proper BVM size, then attach supplemental oxygen, setting rate to 15 liters. Provide proper ventilation. For adults, 1 ventilation every 5 to 6 seconds. For children, every 3 to 5 seconds. Gradually squeeze BVM about 1/3 or until you see chest rise. Do not apply more volume than necessary. Remove BVM and OPA if airway is present. Now, we're about to begin the process of intubation. Place laryngoscope blade in left hand and advance in patient's mouth. Once you see the vocal cords, verbalize it. Place ET tube with right hand by inserting it from the corner of the mouth. As the black line of the ET tube passes the vocal cord, verbalize it. Remove stylet, then inflate cuff, starting with 10 cc for an average size adult. Attach BVM to ET tube. Ensure the supplemental oxygen is connected to BVM at 15 liters per minute, then begin ventilating the patient. Check for placement. First, auscultate 3 areas, starting with the abdomen, then bilateral lungs. You should not hear breath sounds in the abdomen. Visualize for bilateral chest rise and fall to confirm placement of the ET tube. You can also order a chest X-ray to confirm position of the tip of the tube in relation to the carina, ideally 2 to 3 centimeters. Third, confirm endotracheal CO2 with CO2 detector, and then attach oxygen to BVM. You should see a color change that would also confirm that the tube is in the right location. Then correctly apply Thomas tube holder. Apply just enough pressure against the tube to hold securely in place, as over-tightening of the screw may restrict airflow. Now you can secure the tube holder as demonstrated. Do not let go of the tube prior to securing. Order chest X-ray to confirm position of the tip of the tube.